Welcome back to the deep dive. Today we are unpacking a company that you probably see maybe every week, but its real size, its true complexity is so much bigger than what you see on the store shelves.
Oh, much bigger.
We're diving deep into CVS Health.
And it's important to just, set the stage right away. This is not just a retail chain we're talking about. We're looking at the second largest healthcare company in the world.
Second largest. Who's number one?
United Health Group. But CVS is right there behind them.
That scale is just, it's hard to wrap your head around. I mean, we're looking at the 2024 financials, and the revenue was, what, US $372.8 billion?
Billion, with the B.
Mm.
And they have something like 300,000 employees.
Mm-hmm.
It's a true behemoth.
Right. And the sources you've provided, they give us this complete picture from their history of just aggressive acquisitions to this incredibly complex web of subsidiaries.
And crucially, decades of some very serious legal and ethical problems that just seem to follow a company that gets this powerful.
Mm-hmm.
So our mission today is really to get past that image of consumer value stores. That's actually what CVS stood for back in 1963.
I have no idea.
Yeah. And we need to understand how they built this vertically integrated giant, how they got control of prescription management with Caremark, insurance with Aetna, and then the retail clinics with MinuteClinic.
And there's a real tension there, isn't there? This massive scale on one hand, but it brings this massive scrutiny on the other.
It always does.
Okay, so let's break this down. We're going to trace the path from one single store in Massachusetts to this global powerhouse. We'll look at the pillars of their current structure, and we'll definitely spend a lot of time on the controversies, especially the opioid crisis and, the issues with prescription costs. For you, the goal is to see how this company isn't just selling you shampoo. They are really actively shaping the entire American healthcare system.
So the origin story is, it's deceptively simple. It starts in 1963, Lowell, Massachusetts.
Mm-hmm.
It was founded by two brothers, Stanley and Sidney Goldstein, and their partner, Ralph Hoagland. And it was just a store selling health and beauty products.
No pharmacy?
No pharmacy at the beginning. That was the key. The name, Consumer Value Stores, was literal. It was all about low prices on everyday items.
So when did the pharmacy piece come in? Because that seems like the entire identity of the company now.
It took 4 years, 1967. That's when they opened their first stores with actual pharmacy departments, one in Warwick, one in Cumberland, Rhode Island.
And that was the pivot. That was the game changer.
That was the strategic shift. It established this dual identity that they still have today.
Yeah.
A retail store, but one that's anchored by this essential healthcare service.
And then the other defining piece of their DNA showed up just 2 years later.
Aggressive expansion.
Fueled by corporate change.
Exactly. In 1969, they were sold to the Melville Corporation, which is this huge retail conglomerate. And that wasn't just a sale. It was like getting a massive injection of cash. It's what let them go from being a regional player to a national one.
And that's when the acquisition sprint really kicks off. For what, the next 3 decades?
Pretty much. By 1970, they already had 100 stores just in the Northeast. But they knew that wasn't enough.
They needed to go national.
Right. And you can see their strategy on the map. It's so methodical. In 1972, they buy 84 Clinton drug and discount stores.
And that was their first big leap, right? Into the Midwest.
That was it. Centered in Indiana. They learned very early on that it's just faster to buy your way into a market than to build from scratch.
Okay, so they keep filling in the map. Let's jump ahead. 1990,
they buy 500 People's Drug Stores.
500.
And this one was vital. It gave them a huge presence in the Mid-Atlantic. We're talking D.C., Pennsylvania, Maryland, Virginia. It wasn't random growth. They were targeting these critical population centers.
And then in the late 90s, the scale just gets, it gets kind of overwhelming.
Well, that's when they were spun off from Melville. 1996, they start trading on the New York Stock Exchange as their own company.
And they immediately go on a shopping spree.
A huge one. In 1997, they acquire over 2,500 Revco drugstores.
Let's just pause on that. 2,500 stores in one transaction.
Yes. It cemented their footprint across the Midwest, the Southeast, and the East. Overnight, they went from being a major player to, an undisputed national contender. It happened in a single quarter.
And they kept being precise. Like when they wanted to get into Michigan.
They just bought their way in.
Yeah.
207 Arbor drugstores in 1998.
Mm-hmm.
It was like they were playing a game of Risk, just strategically taking over territories.
But at the same time, while they're doing all this brick and mortar consolidation, they're also looking at the internet.
Yeah, which is something a lot of people forget. They were a pioneer in online pharmacy.
With Soma.com.
Right. In 1999, CVS buys Soma.com, which was the first online pharmacy in the country. They quickly rebranded to CVS.com. And suddenly, they're the first company that's truly integrated.
Both physical and digital.
Exactly. They saw where things were going, and they wanted to control that channel right away.
And that desire to control the channel, and more importantly, the customer data, that leads directly to the extra care card.
Launched in 2001. And to the average person, it just looks like a discount card.
Yeah,
Right?
you scan it, you get a coupon.
But for CVS, it was this unbelievably powerful data collection engine. The success was just, it was staggering. 30 million people signed up in the first year.
30 million in a year.
And it eventually grew to over 70 million cardholders. At the time, it was the largest retail loyalty program in the country. And it gave CVS this incredible ability to track everything. Not just what shampoo you bought, but when you refilled your prescriptions, what over-the-counter meds you bought with it. It created this incredibly detailed profile on tens of millions of Americans.
Which laid the groundwork for a lot of what was to come.
A lot of what was to come, both good and, as we'll see, pretty controversial. The buying didn't stop, of course. They bought Statlander Pharmacy in 2000 for their specialty division, and then a huge one in 2004, 1,268 Eckerd drugstores.
That one pushed them into Texas and Florida, right?
Yeah. Yep. High-growth markets. So by the mid-2000s, they were a retail giant. But they were about to have this realization that the real power in healthcare wasn't just in selling the drug.
It was in controlling the system that pays for the drug.
Exactly. And that's where the story takes a dramatic turn. Away from retail and toward vertical integration.
Okay, so part one establishes CVS as this massive coast-to-coast retail chain. But the move that really created the $372 billion company we see today, it wasn't about buying more stores.
No, it was about buying the middleman.
The pharmacy benefit manager, the PBM.
Right. And CVS had been dipping their toes in this for a while. They launched their own PBM called Pharmacare way back in 1994.
Just a small operation.
Yeah, it was more of a strategic test. But the moment that changed everything was 2007.
The merger with Caremark RX.
A colossal merger. It created CVS Caremark, and it fundamentally altered the entire U.S. healthcare landscape.
Okay, so we have to break this down. Because this merger is really the engine of the whole company, right? It's where the money comes from, but it's also where a lot of the controversy comes from.
It is. By joining the massive retailer, CVS, with the powerful PBM, Caremark, the new company controlled two critical links in the chain.
The place where you buy the drug and the system that manages the payment for it.
Exactly. They now controlled not just where you fill your prescription, but the entire mechanism for how your insurance plan decides which drugs it's going to cover and at what price.
So how does the PBM actually do that? How does it create this internal profit machine?
It's all about something called formulary management and rebate negotiation. The formulary is just the list of drugs your insurance plan will cover.
Okay.
Caremark goes to the big drug manufacturers and negotiates massive rebates, we're talking billions of dollars, in exchange for giving a specific drug preferential treatment on that list.
So they get paid by Pfizer, for example, to make sure Lipitor is on the list instead of a competitor's drug.
Precisely. They then pass some of that rebate back to the health plan, but they often keep a significant chunk for themselves. That's called the spread.
So if they're managing the formulary for tens of millions of people, they can steer patients toward the drugs where they, Caremark, get the biggest kickback.
Even if that drug isn't the cheapest or maybe even the most effective option.
That feels like a huge conflict of interest.
It's baked right into the PBM model. They can influence the doctor by controlling what's covered and the pharmacist by controlling reimbursement rates. And because of the vertical integration, the retail pharmacy feeds the PBM and the PBM steers business right back to the retail pharmacy. It's a closed loop, a very, very lucrative closed loop.
And this new identity as a healthcare giant prompted a really public, really strategic move in 2014.
The tobacco decision.
Right. They stopped selling cigarettes.
It was a brilliant move from a branding perspective. September 2nd, 2014, they pull all tobacco products from all 7,700 locations, a month earlier than they had planned.
The CEO at the time, Larry Merlo, he said something like, cigarettes and healthcare just don't go together.
Which sounds purely ethical. It was a good thing to do, but it was also incredibly strategic.
Because it came right before their biggest push into healthcare services.
It was essential. It cleaned up their image. It helped establish the CVS brand as a legitimate healthcare company, not just a convenience store that happens to have a pharmacy in the back. And right after the ban, they officially changed the corporate name from CVS Caremark to CVS Health.
Signaling the new direction.
The new direction.
Yeah.
That the future, the big money, was in services, not in selling candy and magazines.
Which brings us to the final piece of the puzzle, the ultimate integration, Aetna.
The capstone. In December 2017, they announced the deal to buy Aetna for roughly $69 billion.
And this was it was unprecedented. They weren't just buying more pharmacies, they were buying the system that pays for everything.
Everything. Before Aetna, they controlled the drug benefits through Caremark. With Aetna, they got the whole insurance mechanism, medical, dental, behavioral health plans, everything for Aetna's 22 million members.
So now, if you're an Aetna member, your prescriptions are processed by Caremark, and you are, let's say, strongly encouraged to fill them at a CVS.
You are. They can keep all the profit streams internal. They get the insurance premium from you. They get the PBM spread from the drug company, and they get the retail profit from the sale. The whole system is designed to keep every dollar inside the company.
And you could see this strategy change the actual stores almost immediately.
Oh, yeah. After the merger, stores started these massive renovations to focus more on health services and less on traditional retail.
And that's where the health hub idea comes from.
That's the genesis. It launched in Houston in 2019. And the plan was super ambitious. They wanted 1,500 health hubs by the end of 2021. The pandemic slowed that down, obviously.
So what's the real difference? If I walk into a health hub versus a regular CVS?
It's a totally different layout and staff. At least a fifth of the floor space is dedicated to services. You'll see rooms for health screenings, areas for managing chronic conditions like diabetes, more medical equipment, and a much bigger MinuteClinic space.
So they're literally ripping out aisles of greeting cards and seasonal candy to make room for clinical care.
That's exactly what they're doing, and they're staffing up for it. Health hubs have care concierges to help you navigate services. The MinuteClinic has more support staff medical assistants, RNS, to help the nurse practitioners and physician assistants.
They're turning the corner drugstore into a front door for primary care.
That's the goal.
Yeah.
Make the most of that incredible physical footprint we talked about earlier.
So we have the big three: Caremark, Aetna, and the retail pharmacies. But to really get the full picture of CVS Health, you have to look at all the other subsidiaries, all these specialized companies they've acquired to make their model, almost bulletproof.
Yeah, when you connect all the dots, you see this ecosystem that lets them manage and monetize a patient's entire journey from start to finish.
Okay, so let's start with the one everyone knows, CVS Pharmacy.
It's just massive. 9,600 stores, all 50 states, D.C., Puerto Rico. The scale alone gives them incredible power.
And the reach it's just unavoidable. They fill more than 1 out of every 5 prescriptions written in the United States.
And 85% of the U.S. population lives within 10 miles of a CVS.
Oh.
It's a piece of the American landscape.
Okay, next up, the engine of the whole thing, CVS Caremark, the PBM.
We know its job is managing benefits, but the scale is what's important here. Caremark manages prescription dispensing for more than 75 million people.
75 million.
It does everything: plan design, formulary management, claims processing, mail order, specialty drugs. And here's the key part. It doesn't just do this through CVS stores.
Right?
It has a network of over 68,000 retail pharmacies, chains, independents. So even if you go to your local neighborhood pharmacy, chances are your payment is still being run through the Caremark system.
They get a piece of the action no matter where you go.
Pretty much.
And then the third pillar, Aetna, is the one that pays the bills.
Aetna provides the funding: medical, dental, pharmaceutical insurance. The huge strategic advantage is that if you are both the insurer and the PBM, you don't have to negotiate with anyone. You set the prices internally. The profit margins are all yours.
Total control.
Total control. And then the front door for a lot of people for simple things is MinuteClinic.
The walk-in clinic inside the store.
Right. It's the lowest cost way for them to get you into their system.
Yeah.
It's the biggest walk-in clinic chain in the U.S., over 1,100 locations. Again, super accessible. Half the population lives within 10 miles of one.
And it's for, minor stuff. Vaccinations, strip tests, things you don't want to go to a doctor's office or an expensive urgent care for.
Exactly. It's a feeder system. But beyond those main consumer parts, they have these highly specialized divisions for the really complex, really expensive conditions, which is where the biggest profits are in healthcare.
And that's where CVS Specialty comes in.
Right. This is the largest specialty pharmacy in the U.S. It handles the incredibly complex and expensive drugs for things like cancer, rheumatoid arthritis, genetic diseases.
And these specialty drugs are a huge chunk of all drug spending, right?
A hugely disproportionate amount. So by controlling this segment, CVS Health makes sure all that high-margin business stays inside their system.
What about patients who need care at home, like IV infusions?
That's Coram. They acquired Coram in 2014. It provides home infusion services to about 140,000 patients a year. And the synergy is brilliant.
How so?
Aetna, the insurer, can say, we're not going to pay for this expensive infusion in a hospital. You have to get it at home from our company, Coram. They lower their costs and keep the profit, all under the CVS Health umbrella.
And they're also deep inside places like nursing homes.
That's Omnicare, which they bought in 2015. Omnicare is the pharmacy service provider for thousands of skilled nursing and assisted living facilities, so they manage drug access for one of the most complex patient populations out there.
It's an incredible network, and their latest moves show they're not done building, they're going after primary care now.
This is their future. They want to control healthcare from the very beginning. In 2022, they bought Signify Health for about $8 billion.
What does Signify do?
They specialize in in-home health evaluations, trying to manage care before people get really sick.
And then the huge one in 2023, Oak Street Health.
For $10.6 billion. This is a monumental move. Oak Street Health is a network of primary care centers that focuses on Medicare patients. This tells you that CVS Health doesn't just want to fill your prescriptions anymore. They want to be your doctor.
They want to be your primary medical home.
They want to manage your health from the yearly checkup all the way through your cancer treatment and insurance claims.
And all the while, the retail stores are still there, pumping out foot traffic and, more importantly, data.
That's the secret sauce. The retail side isn't just about selling toothpaste. It's about that massive data pipeline from the Extra Care card, which they now monetize through the CVS Media Exchange, or CMX. It lets them sell targeted advertising with surgical precision. It's just another revenue stream built on top of the whole structure.
So we've laid out the scale, the structure of CVS Health. But that integration, especially with the PBM, has put the company under constant legal and public scrutiny. To really understand this company, you have to spend time on the sheer volume of these issues.
You do, and it's critical to see that the very thing that makes the PBM so profitable, these complex, secret negotiations over drug costs, is what repeatedly gets them into trouble for fraud and deceptive practices.
Let's start at the beginning of the PBM era. Even before CVS bought them, Caremark had a history of scandals, right?
Oh, yeah. Back in the late 80s and early 90s, Caremark was involved in multiple health fraud and Medicare fraud scandals.
With the government.
Yes. And it resulted in settlements costing the company more than $250 million. So this pattern of regulatory trouble was there from the very start.
And that trouble followed them, leading to a huge settlement in 2005 over pharmaceutical kickback.
Right. Caremark paid $137.5 million to settle federal lawsuits. The allegation was that a company they had just bought, Advanced PCS, was taking kickbacks from drug makers.
So basically, they were getting paid to push certain drugs over others.
Exactly, to promote their products, even over cheaper generics, in government programs like Medicare. The decision about which drug you get was being influenced by a corporate payment, not just what was best for you or what was cheapest.
And while they didn't admit they did anything wrong,
A $137.5 million settlement tells you how serious the government thought it was.
this same pattern led to another big lawsuit in 2008, the one for deceptive practices.
This one was so revealing. It was a multi-state lawsuit, and they settled for $38.5 million. It really exposed the mechanics of how Caremark was profiting from something called drug switching.
What's that?
Attorneys general from 28 states alleged that Caremark was telling doctors to switch patients to certain brand-name drugs, and they were marketing it as a way to save the patient or the health plan money.
But that wasn't actually true.
Not always. The investigation found that the switch often led to tiny savings, or sometimes it even increased the cost. But the real winner was always Caremark, because they were steering business to the drug companies that gave them the biggest rebates.
The patient was just a pawn in the middle.
A pawn in a revenue game. The settlement was a big deal, though. It put some real guardrails in place.
But we need guardrails.
CVS was explicitly banned from telling a doctor to switch a drug if it would cost the patient more. And they couldn't suggest a switch if the original drug's patent was about to expire, which was a classic trick to squeeze the last bit of profit out of a brand name before a cheap generic hit the market. And beyond the financial issues, there's this recurring problem with how CVS Health handles patient data. It's the most sensitive information they have, and they have repeatedly gotten in trouble for it.
The first big public blow-up was way back in 1998 with the Alensis incident.
A real wake-up call. CVS was caught sharing specific prescription information with a marketing company called Alensis.
What was Alensis doing with it?
They were using it to send targeted mailings to people's homes, You know, time to refill your heart medication or promoting related products.
People were outraged. I remember the editor of a major medical journal called it a gross invasion of privacy.
The medical community was furious that this intimate health data was being used for marketing without any real consent.
So what happened?
After a huge backlash, CVS cut ties with Alliances. But they didn't stop the practice. They just brought the whole targeted mailing program in-house.
So they kept using the data, they just controlled it themselves.
Exactly. And this problem of protecting data came up again big time in 2009. They settled huge charges with both the Federal Trade Commission and the Department of Health and Human Services.
The FTC and HHS.
The FTC said they failed to protect sensitive customer and employee information. And they paid HHS $2.25 million for violating HIPAA, the big health privacy law. It just showed a pattern of failing to meet the standard required when you handle this kind of information at such a massive scale. But of all the controversies, I think the ones related to the opioid crisis represent the biggest challenge to their image as a healthcare company.
Some of the details are they're damning. The DEA investigation in 2011 in that one small town in Florida, Sanford, population 53,000.
The DEA found that the CVS pharmacies there were ordering enough painkillers to supply a city 8 times its size.
8 times?
Around 400,000 people. The volume should have been a massive red flag.
Just break down the numbers on that one store.
One single CVS in Sanford ordered 1.8 million oxycodone pills in 1 year.
1.8 million.
That's almost 138,000 pills a month. The average for other pharmacies in Florida was around 5,300 a month. It's just an astronomical difference. It screams diversion.
And the investigators saw it happening with their own eyes.
They did. They noted that about every third car in the drive-thru was picking up a prescription for oxycodone or hydrocodone. And pharmacists admitted that customers were coming in using street slang for the drugs, clear signs they were being sold illegally.
And this lack of oversight wasn't just in Florida. Massachusetts settled with them in 2016.
For almost $800,000. That settlement was about them failing to give their pharmacists access to the state's prescription monitoring program, the PMP.
The database that's supposed to stop people from doctor shopping for pills.
Right. By not checking it, they were just fueling the crisis, filling prescriptions without doing the basic due diligence required.
But the real legal earthquake was the federal jury verdict in Ohio.
November 2021. A federal jury found CVS, along with Walgreens and Walmart, liable for helping to create the opioid crisis in 2 Ohio counties. And this was a huge deal because it was the first time the pharmacy companies themselves were held accountable in a trial.
So what was the legal argument? What did the jury decide was their failure?
The argument was their failure to monitor. The law says pharmacies have a responsibility to make sure prescriptions are for a legitimate medical purpose. They're supposed to flag and stop suspicious orders, ones that are too big, too frequent, too many cash payments. The jury decided that CVS's systems completely failed to do this, and that failure allowed the flood of pills to wreck these communities.
And the financial penalty for that was massive.
It was. In August 2022, the judge ordered CVS and the others to pay $650 million in damages just for that one lawsuit. It set this huge precedent that pharmacies are co-liable for the epidemic. It was a game changer.
Beyond these huge systemic issues, there's also been this steady drumbeat of problems with just basic dispensing accuracy.
Which is supposed to be the one thing a pharmacy never gets wrong. In 2005, an investigation in Boston found 62 different errors or quality problems over a few years. It was so bad the state had to bring in a nonprofit to monitor them for 2 years.
And they've also got into trouble for what they sell on their retail shelves.
Right. In 2018, the Center for Inquiry sued them for consumer fraud over selling homeopathic medicines.
The argument being that these products don't actually do anything.
And that by putting them on the shelf next to real medicine, CVS gives them a credibility they don't deserve. The lawsuit argued it was dangerous because people might choose these ineffective treatments instead of getting real medical care, which could make them sicker or even lead to death.
It's a real ethical question for a company that calls itself health. But these errors can have just catastrophic human costs. The incident in 2023 was heartbreaking.
Just a terrible, tragic case of human error. A patient, Tamika Thomas, was going through IVF. She was supposed to be given medication to help her pregnancy. Instead, the pharmacist gave her misoprostol,
An abortion pill.
an abortion pill. She lost both of the embryos she had transferred. Her quote was just, "They just killed my baby." It's a devastating reminder of what's at stake.
And what were the consequences for CVS?
The 2 pharmacists were fined and put on probation. And CVS Pharmacy, the corporation, got the maximum fine. $10,000.
10,000.
Yeah.
Wow. Let's also circle back to the pricing issues. They were fined for misrepresenting Medicare prices too, weren't they?
They were. In 2012, they paid $5 million to settle FTC charges that they misrepresented the prices of certain Medicare Part D drugs for things like breast cancer and epilepsy. Again, it's a breach of trust with a really vulnerable population, and it ties right back to the PBM's control over pricing.
So we've gone through the transformation, the model, and the decades of controversy. To finish up, let's look at where the company is headed now and how they try to balance all this power with being a good corporate citizen.
You can really see their strategy in their operational decisions. They are all in on the Health Hub and the Oak Street primary care model, and they're moving away from just being a retailer.
That's behind the store closures, right?
Exactly. In 2021, they announced plans to close 900 stores over 3 years.
Which is about 10% of all their U.S. stores.
It's a huge number. But they justified it by saying consumer behavior has changed, and they need to focus on their future in healthcare delivery. They're getting rid of underperforming retail locations so they can invest that capital into building out more clinical spaces.
But even as they're closing some stores, they're finding new ways to make money off the ones that are left and off their website.
That's where the CVS Media Exchange, CMX, comes in.
Their advertising network.
It's their retail media network launched in 2020. It's an increasingly common way for big retailers to monetize their customer data. They use all that extra care card information to let other companies like, a cereal brand or a soda company target ads with incredible precision on CVS websites and apps. Just another high-margin revenue stream.
And despite these changes, the sheer financial scale of the company is it's still immense.
The 2024 numbers are still hard to believe. $372.8 billion in revenue, $253.2 billion in assets. When a company is that big, their decisions just fundamentally impact the cost and delivery of healthcare for everyone.
So, on the other side of the coin, how does the company try to project a positive image? What are they doing in terms of philanthropy and social commitments?
They do have some long-standing initiatives.
Yeah.
The CVS Samaritan vans, for example, have been providing free roadside assistance since 1978, and their charity Golf Classic has raised millions for nonprofits.
And they've responded to consumer pressure on issues like animal welfare.
They have. In 2016, they made a public promise to source 100% cage-free eggs. And to their credit, they actually did it ahead of schedule by the end of 2022. It shows they can execute on these kinds of public promises when they want to.
And their most recent big commitment is in an interesting area, affordable housing.
Right. It shows they're thinking about the social determinants of health. In 2024, they committed almost $35 million to help build 2 affordable housing developments in Hawaii.
Creating hundreds of new homes.
Exactly. It's an acknowledgement that a person's health is about more than just what happens in a pharmacy or a clinic. It's about addressing these bigger structural issues. So we've covered this incredible journey from a single consumer value store to, the second largest healthcare company in the world.
It's a really powerful story of corporate growth, built on that retail expansion in the 90s, and then the huge strategic shift with the Caremark merger in 2007 and the Aetna acquisition in 2017. What's clear is that the face of the company is the store, but the engine is the PBM. It's the thing that drives the revenue and, at the same time, is the source of all these controversies over costs and kickback.
Yeah. The key takeaway for you is that CVS Health isn't just a bunch of different businesses. It's one highly centralized system that controls your prescription insurance, your drug benefits, your local pharmacy, your specialty care.
And now they're coming for your primary care doctor with Oak Street Health.
They are. This concentration of power just makes them this undeniable force that shapes the healthcare experience for basically every American.
So we'll leave you with a final thought on all this. CVS Health says its mission is to improve the future health of Americans. But its history is filled with massive settlements for deceptive practices and a federal jury literally finding them co-responsible for the opioid crisis. Can a corporation that controls so much of the system and carries that much baggage truly earn the public trust it needs to be your primary care provider?
Think about that tension. That conflict between optimizing for profit and being a trusted healthcare partner. Think about it the next time you're in a health hub, or your prescription is run through Caremark, or you use your Aetna insurance card. That complexity is modern American medicine.
Until the next deep dive, stay curious.